It's important to remember that not everyone who is depressed is suicidal. You can still seek help even if you haven't demonstrated any specific suicidal or self-harm behaviors, or even if your symptoms aren't as severe or persistent as the symptoms noted above. I'm feeling depressed. So now what? Now that you know the symptoms of depression, some positive coping skills can be useful. All of the following techniques are supported by scientific research and medication prescribers like psychiatrists, and these skills are frequently recommended as important parts of treatment even for patients who continue to take antidepressant medications. Practice these coping skills every day. I recommend doing many, if not all, of the following coping skills and techniques once a day when experiencing depression. The patients I work with who frequently practice these coping skills get better. The 7 techniques can be memorized with the acronym My Peers. 1. Meaning: find small ways to be of service to others. Find personal meaning by serving something larger than yourself. Remember, service doesn't have to be big to count. Consider this: success, like happiness, cannot be pursued, it must ensue, as the unintended side effect of one's personal dedication to a cause greater than oneself. 2. Peer goals. Find workable goals that give you a sense of accomplishment. Most people feel guilty when talking about goals because they set unreasonable or unworkable goals. A goal is workable if it's something you can control, manageable, realistic for you, measurable. 3. Pleasant events. Schedule pleasant activities or events. Don't wait for yourself to be in the mood. For example, give yourself permission for a 30-minute vacation or schedule a healthy hobby every day. Just remember to do these activities with the right attitude. See engagement. Also, practice gratitude. For engagement, stay in the present. This practice is sometimes called mindfulness. As best you can during activities, try not to be in your head with self-judgment. You may not be able to turn off the self-judgment, but you can notice it and bring yourself gently back to the present. Research shows that people with higher self-compassion also have higher self-worth or self-confidence. 7. Sleep regularly. Try to keep a regular sleep schedule. Keep a balance with not too little and not too much sleep. Staying up late one night and then sleeping in excessively the next day is a surefire way to feed depression. Also, don't try to solve problems late at night when your brain is half asleep. As you practice these coping skills, know that you are on the path to overcoming depression. In contrast, depression tends to linger when patients make up a reason why they can't do these things. No matter what medication you are taking, doing several of these activities every day, especially when you don't feel like it, is vital to the treatment of depression. These positive coping skills may take time and practice, but if we don't take the time to be well now, the periods of unwellness may be forced upon us later.